Mouth cancer can start in several parts of the mouth, including the lips, gums, or soft parts of the mouth. Oropharyngeal cancer begins in the oropharynx. The oropharynx is the part of the throat, pharynx, just behind the mouth. These include tonsil cancer and cancer of the back of the tongue. What are risk factors? Anything that can increase your risk of getting a disease is called a risk factor. Different cancers have different risk factors. Having one or more of these risk factors does not necessarily mean you will develop that cancer. Cause of mouth cancer. 1. Smoking. Smoking tobacco, cigarettes, pipes, cigars, increases your risk of developing oral and oropharyngeal cancer. Research has shown that around 25 out of every 100 cases of oral and oropharyngeal cancer in the UK, around 25%, are caused by smoking. People who smoke are at higher risk if they drink alcohol and chew tobacco or betel nut. There is some evidence that people with long-term exposure to second-hand smoke, have a slightly increased risk of developing oral and oropharyngeal cancer. 2. Alcohol. Drinking alcohol increases the risk of oral and oropharyngeal cancer. It causes around 35 in 100 cases of oral and oropharyngeal cancer, about 35%, in the UK. Smoking and drinking together increase the risk of oral and oropharyngeal cancer. UK guidelines recommend that both men and women consume a maximum of 14 units of alcohol per week. 3. Chewing tobacco or betel quid. Smokeless tobacco, including chewing tobacco such as betel quid, gutka, or pan, is known to cause oral cancer. It is not a safe alternative to cigarettes. 4. Diet. A diet low in fruits and vegetables may increase the risk of oral and oropharyngeal cancer. This may be due to a lack of vitamins and minerals. A balanced diet usually means getting enough vitamins and minerals. 5. Human papillomavirus, HPV. Human papillomavirus, HPV, is a type of virus that infects cells lining the skin and body cavities. It is estimated that about 80 out of 100 people, approximately 80%, will be infected with HPV at some point in their lives. For most people, HPV doesn't cause any harm and gets better on its own. It doesn't cause cancer-like infections. However, the virus can cause changes in the mouth and throat. These changes make them more likely to develop into cancer in the future. HPV is usually spread through close skin-to-skin contact during sexual activity. Viruses are very common. However, only a very small percentage of people infected with HPV develop mouth or oropharyngeal cancer. There are more than 100 types of HPV, and each type has a number. The main type of HPV found in oral and oropharyngeal cancer is HPV-16. HPV causes around 25 out of 100 cases of oral and oropharyngeal cancer, about 25%, in the UK. The association with HPV is much stronger for oropharyngeal cancer than for oral cancer. Recently, HPV-positive oropharyngeal cancer has been increasing. Compared to HPV-negative oropharyngeal cancer, patients with HPV-positive oropharyngeal cancer have. Patients with HPV-positive oropharyngeal cancer generally have a better outlook, prognosis, than patients with HPV-negative oropharyngeal cancer. 6. Family history. Studies have shown that having a very close relative is associated with a slightly increased risk of developing oral and oropharyngeal cancer. For example, you may have a parent or sibling who has head and neck cancer. Further research is needed to understand why this is the case. 7. Blood pressure medication. Hydrochlorothiazide. Hydrochlorothiazide is a drug that treats high blood pressure, hypertension. A side effect is increased sensitivity to sunlight, photosensitivity. A small study found that this drug may increase the risk of developing lip cancer. Can oral cancer be prevented? To prevent oral cancer, it is important to quit smoking and reduce alcohol consumption. Also, don't forget to protect your lips from the sun. Even if you wear dentures, keep your mouth clean and see your dentist regularly.